We are here. Good morning. It is the sunspot. It is now time to talk about some fun stuff, I guess you could say. Cindy, I don't know if I'd call it fun or at least blah, blah. Yeah, I need some coffee too. But you said you don't drink coffee.
I don't drink coffee,
Oh,
but I did get something with a lot of sugar in it.
wow. All right.
That's all.
Now, I
Yeah.
took a little more leisurely stroll this morning, so I'm not quite as out of breath, because I'll make sure everybody understands I'm the only one here this early in the morning. So the studio for Kix is on one side of the building. The studio where the show originates is on the other. And fat boy like me has quite a long walk.
You got this.
I got it. Not a problem at all. Hey, I'm 15 pounds down, so I'm happy about that right now.
Awesome.
Yeah, I
I bet
still
you
got
just
one.
lost 10 doing that.
At least 5. You're right. You're right. So it is so good to have you back in here, Cindy. Of course, tell everybody who you are real quick.
I'm Cindy Fisher, and I am the publisher and owner of the Selma Sun. And we're the weekly newspaper here in Dallas County. Comes out on Thursdays. So we come on here each week and have some awesome guests and are having a great time with Kix and with Todd Prater. This has been so much fun. This is our fifth one, I think.
It is. Yes, it is the fifth show, and we have got a loaded show today, too.
We do.
I mean, we've got Cachet Smith from Rural Health. We've got Dr. Tiffany Maycock from UAB, and we've got Cheryl Smedley from the Chamber of Commerce. And if we have time, I have an interview with Bullet Hand. That we'll try to talk to him about the new coach over at Morgan Academy. So we need to get all that stuff in.
I know, that's a lot.
Yeah, it is a lot. Well, and I was going to start with some numbers just to let everybody know, and we were talking about this just a little bit ago, that across the state, as of just a few minutes ago, there's 5,327 cases. That's 5141 active, 185 fatalities. Here in Dallas County, 29 total, 27 active, 2 fatalities. And I got numbers for the counties around us. All of them are about the same. We seem to be holding kind of steady, about the same amount, but it's increasing a little bit. And as we were talking about, it seems like you say you have a story coming out tomorrow that says it flatlined a little bit, but we're increasing just a hair now.
Not just a hair. So our first case was found or confirmed March 25th. And as of the 21st, we have 29 cases.
Right.
So it's gone up about 14 times. And a lot of that is, like we were talking about, with having the testing available, that we can make sure that we, who has it, who doesn't.
Right.
And that's increased a lot here in Dallas County. Maybe why our numbers have gone up.
Well, the availability of testing, the turnaround of the testing is getting better, and I think a lot more people are more aware of the possibility they have the symptoms. So there's probably more people going to get tested.
Yes and no. I know that the urgent care centers have been concerned about people not coming in at all.
Really?
And some of that is because some people are afraid they're going to get it by going there.
That's true.
So let's say they cut a finger while chopping fruit or vegetables. They don't want to go get stitches because they think they're going to get COVID. So I think there's just a lot of fear in the community, and if I get it, am I going to be okay, or do I pass it to someone a loved one that won't be okay? But so far, it does seem like, and it probably helps being a more rural community, that I know I have been able to quarantine and, well, really not see anyone.
Yeah, no, yeah.
Yeah, except my kids, But I think that it is possible to do it here in Dallas County to stay away. But I know that we've had and I've seen some issues where there are still folks that want to gather.
Yeah, I'd spoken with Mayor Melton last week about that he was still concerned that there's too many people that are gathering in, more than 10 and going places they're not supposed to be going, like some of the city parks and what that are closed. So that still tends to be a little bit of an issue around Selma and Dallas County. So we need to be sure that we're following that. And that brings me to the fact that there are they're talking about opening the country back up. That's the term, opening businesses back up. And businesses need to be opened up. There are some small businesses, and we're going to talk to Michelle Smedley about some of the grants and loans that are available for those. But there are some small businesses that if they don't open back up soon, they may go under completely, and we understand that. The problem is weighing the safety concerns, health safety concerns, with the financial and economic concerns, and I think that's where the problem comes. I saw that Georgia is going to start a phase-in opening of businesses Monday. Tennessee and South Carolina will be following suit in the days following. Yesterday, Governor Ivey had a press conference with a number of officials, including economic and health and whatnot, and they have recommended a phasing in of getting businesses open, and apparently they're still studying the situation. Governor Ivey has not said when the state of Alabama will lift the stay-at-home order, but that is being addressed. Just it hasn't happened like it is in Georgia and other states yet.
But she did kind of put it off, and
yeah,
there were a lot of people that were pleased with that.
On the same token, there's a lot of people that are not pleased with it. So that's where the problem is. There's a lot of people that are fussing, why isn't she going on and do it? But like you say, there's some that are saying, well, let's just kind of feel the situation out a little further. We don't want to jump too soon.
So we have a story on page 8 this week that really breaks down this report that was released last week, or was it earlier this week, that's saying, if we were to reopen, here's how we would recommend that. So, for instance, hair salons, it is a one-on-one, so you could have 6 feet apart with the exception of you and your stylist.
Right.
But they're saying that the stylist would take your temperature when you walk in.
Oh,
have to write down each person that's there, what their temperature is at the time they come. So it puts a lot of onus on the business owners to keep up with that.
I would love to know what the general public is thinking and see what the thought is out there, because I'm going to keep my eyes open for that kind of information, because, a lot of us are saying, well, gosh, this is ridiculous. And a lot of us are saying we can't be too careful. So where is that common ground in the middle where we're being careful enough, but we're not waiting too late to
and I think this report addresses that. What I think would be the biggest problems would be, and I love going to the movies. I know that my kids don't, so I guess that's a generational thing.
Right.
But I love the popcorn. I have a whole system on how to get the drip the popcorn, the butter on it and everything. I use a straw so I can make sure I get to the bottom. I got a video online of me doing it. Yes.
Well, if I was as skinny as you, I could do that too, but
hey, it's cholesterol, dude. I still
oh Lord.
I still have a problem with that. But the movie theaters, I can see not opening that because everybody's gonna sit near each other, cough or whatever for 2.5 hours or whatever. I could see maybe a boutique opening like Queen City Market or something where you can have fewer than 10 people in there at a 6-foot distance. I don't know. Yeah. But they touch things.
Yeah, that is kind of that's a real iffy ground. I mean, hairstylists, nail salons, things like that, do you really want to go?
They're going to be pretty close.
Yeah, you're going to be right there up in there. I mean, my arm is not 6 feet long. Sorry. So if I'm going to have my nails done, which I've never done, I don't do that. But just if I was,
Right.
am I? I'm going to be within a
Now
foot
your
of the person.
feet, they might could be 6 feet away from doing your
Yeah.
toenails.
But who's going to go
There's
get
someone
toenails?
who loves getting her toenails done.
Oh wow, really? I get nervous when people mess with my toenails. But I mean, if you're going to get your toenails done, you're probably going to get your fingernails done too. So
Right. Well, and actually they wear masks anyway doing nails because of the fumes and stuff,
right,
but
right. But
that's not here nor there. It's more like a slippery slope. If
yeah,
you're going to open one, then everybody's going to say, "What about me?" And before you know
yeah.
it, everybody's open again and spreading it.
Yeah, and that's part of the consideration. What they've got to figure out how to make it work so that it's, I guess you'd say, fair for everybody, and that
Well, and I
cannot be
think
easy.
I hear what they're saying in Georgia, which is, hey, we can handle this better when they get it. We can treat them better.
Right, right.
Um, which actually I'm not sure if that's true, but
I'm not a
just because
doctor.
there
I
are
don't know.
some that get it and then don't, not even a ventilator is going to save them.
Right.
But the testing I think is the big thing, and we do have a story this week that's looking at the trends from the start to now. But we also, in the Selma Sun, but we also talk about the testing.
Oh, okay, good.
And last week on this show, David McCormick with Vaughan Regional Medical Center had talked about the possibility of getting new tests that have a faster turnaround
Right.
and are pretty accurate. I think was literally what he said. Because if it gets sent away for 5 days, we'll take pretty accurate to get some kind of result in a
Yeah.
few hours or one day. Um, and then, this isn't in the story, but I'm very curious to see about this sort of team they're putting together. That I hear they're going to check. Okay, so let's say you get diagnosed with it and confirmed with it. They're going to go look anyone that you talk to or within 6 feet of.
Oh.
With it, in China, they did an app that would ding you if you have been around someone. That's what I've heard, and it kind of gets the Big Brother question in there.
That's another problem that's going around the country.
Absolutely, it's like I want to know if
Is
I've
this Miss Smith?
encountered someone.
Good morning.
Good morning. I got Miss Cachet Smith on the phone now from the Rural Health. Hey, Miss Cachet, this is Todd Prater with Cindy Fisher, and we wanted to say good morning to you and ask how things are going at Rural Health.
Sure. Thank you for having us today. We truly appreciate the opportunity to continue to educate our community on rural health's position during this COVID-19 pandemic. Right now, Rural Health is in the partnership with several of our communities in continuing to centralize information related to the different waivers with the insurance payers, expansion of programs, services such as nutrition programs, housing, utility assistance, also with qualifying people with extensions in healthcare services to ensure that they're still able to receive primary care services, even from their homes via telehealth services through telemedicine, video and audio. We're also still seeing certain patients, our chronically ill patients that have diabetes, high cholesterol, hypertensive. Our dental staff, optometry staff, they are doing emergency appointments only and are seeing patients virtually. So we do realize that even during this time, we still have to take care of our community's primary healthcare needs.
Right.
We're also just received testing from the Department of Public Health, and so that's good news. We received over 200 tests, and we are gearing up to start offering tests across all 5 of our counties that we serve. However, like most non-hospitals and nursing homes, we are in dire need of PPE supplies. So what myself and my marketing and branding consultant, Ms. Danielle Wooten, and my operations director, Ms. Dr. Maneka Nicholson, we're going to reach out to some of the local hospitals and other organizations in our community as a call to action, because we want to continue to support in the best way that we can. And in order to test, we definitely need the PPE to test in our communities to make sure that our staff members are safe, and we're also preventing any exposure to our patients of COVID-19.
Right. And Cindy, didn't you have some questions for Ms. Cachet?
Oh, I just wanted to know do you guys have any ability to do testing? Have y'all seen any cases?
Well, we do have, so to answer your first question, we have not tested to date. We are gearing up to test. We have worked with the public health department, and we have ordered and requested COVID-19 testing kits. We have received some of those to date. And like I just mentioned, what we are waiting on is PPE, so gloves, gowns, N95 masks, et cetera. Those are things that we are awaiting to receive from different vendors at this time. However, we are, like I stated before, we are going to reach out to some of our partners, so some of the rural hospitals in our counties and some of the other organizations that may have had a opportunity to receive more supplies that may not be putting them into use, so that we can take that place in our community and assist with standing up additional testing centers.
So if we could get some folks to share around a little bit to help, and that would increase the amount of testing available if y'all had the PPE, and that would be a big help, I assume.
Absolutely. I do think that we all, as essential workers, healthcare workers, understand that we're all in this together.
Right.
And what's important during this time, resource sharing is definitely going to be something that we all definitely have to do, even when it comes to staffing or ideas on how to maintain our current healthcare placement in the community. You know, when it comes to prevention and protecting our staff, making sure that we're making the right decisions, positioning ourselves to definitely stay open beyond April 30th, because that's very important to a community, to make sure that you have your providers, your nurses, your medical assistants, your ambulatory services.
Sure.
So regardless of what that looks like, sharing of PPE, sharing of testing if you don't have the PPE, or ideas on how to continue to be a frontliner, those are things that we are definitely all working to do.
And Cindy, didn't you have some questions about teleconferencing?
So, leading into that, I've heard of a couple of urgent care centers have mentioned that folks are kind of scared to come in with other issues. I know you'd mentioned diabetes and cholesterol, that you still need to get checked for that. Have you seen that fear kind of kicking in on some of your patients, not wanting to come in with fear of catching COVID? And how are you addressing it?
Absolutely. So one of the things, when I first started by saying, we centralized information in each county, we've taken our social workers, some of our office managers, and our medical assistants, and we created what you call an enabling team. Those team members, in the process of educating people, our current patients actually, on expansion of services, we are confirming things with our patients, like the last date seen, if you're due for immunization, if you have not, completed your routine blood work in the past, 3 to 6 months. We are contacting our patients to let them know that even though we are focused on testing and prevention of COVID-19, we also still are working to make sure that their primary health care is number one. We are still taking preventative measures if they need to come in. We are scheduling, for example, if you are an individual that has not had your annual wellness visit in 12 months, we are calling to confirm your appointment starting in the month of May. If you're someone who has not had your dental hygiene in 6 months or 12 months, we're making sure that we're calling and scheduling those appointments. If you have an abscess or a tooth that needs to be pulled, we are scheduling patients based on the volume that's coming in to actually come in and get that service done because that's considered urgent. What we're doing, like all healthcare facilities, we are using the CDC guidelines and pre-screening our patients if we confirm an appointment. We're also using our outdoor parking lot in our patient cars as the waiting room versus having people inside the clinic waiting to be seen to practice social distancing. We have nurses that are standing at our doors, making sure that we're taking temperatures, assessing the patients physically, and again, addressing those CDC guidelines when it comes to answering the COVID-19 symptom questions. Now, for those patients that are interested and feel like they've been indirectly or directly exposed to COVID-19, we've also stand up a patient care coordination triage line where we have four nurse practitioners that anyone in the community that's not a patient or our patients to call those individuals, and it's broken up by county. And we do assess those patients, and then we are routing them to the closest testing center based on their addresses. So we have seen internally and externally our patients that feel like I have been exposed or I'm showing some symptoms. And we are following the guidelines for employees and for patients where we are routing them to get tested. To date, we've had eight staff members that felt like they were exposed, and of those, they've been tested, and thankfully, we have not had any cases within our organization of COVID-19. We have, however, had some patients that were asymptomatic or were not asymptomatic and have COVID-19, but the most important part was that standing up that triage line allowed them to not come into the clinic and expose staff members and or other patients because we were able to do audio services and assess them over the phone and then route them to the nearest testing site.
And what are the counties that you're covering?
Sure. Dallas County, Perry, Marengo, Wilcox County, and Monroe.
And the phone number, if anyone needs your services, how do they get in touch?
Sure. 334-874-7428. That will route you to our appointment line. And from there, if you need to do anything outside of appointments, if you needed to be triaged to one of our COVID-19 patient care coordinators, we can route you to that individual. If you need to book a specialty emergency service, we can take care of you there as well. Or if you would like to speak to your provider but do not have the exact number of that clinic, we can take care of that as well and route you to that clinic.
Fantastic. Now, Cindy, do you have any more questions?
No, that's wonderful. Thank you, Cachet.
Thank you so much, Ms. Cachet.
No problem.
It's good to talk to you again.
You. Same here. Have a great morning.
You too, and we'll talk to you again soon. Thanks.
No problem. Bye-bye.
That's Ms. Cachet Smith at the Rural Health Medical Center. She's a really, really, really nice lady. I really enjoy dealing with her and working with her. So obviously they've got it down. They've got it all figured out, and they all are starting to get into the testing. But if you need testing, you can call them, and they will direct you to the right place. So sounds like they have a good system down so far.
Yeah, I like the triage system, and this shows how simple it can be
right.
to ensure. I mean, to triage using the stay in your car for your waiting room. That's
great idea.
A great idea.
Yeah.
You can do a temperature of someone from their car.
Sure.
And then determine. You need to go get tested at Vaughn or the health department during that time. and then they never come in. I mean,
Well,
it's
and you mentioned the health
it's pretty
department.
genius, isn't
Yeah, yeah. I
it?
mean that is ingenious. And you mentioned the health department. Dallas County Health Department's COVID-19 testing every Tuesday, 10 a.m. to 2 p.m. And if you have symptoms and feel like you need to be tested, you can call them at 874-2550, 334-874-2550, and you'll be able to get the test there. I'm going to get Dr. Maycock on the phone. Let's check
Okay.
in with what they have got going on over at UAB. And her number is, I know, isn't
And
it great hearing the
Dr.
beeps?
Maycock is great. She,
Oh,
with
yeah.
general medicine, and Cachet is amazing with what they're doing in the rural communities. Reach out.
Yeah.
It's just totally outreach, and I believe that's what UAB is doing. I'm looking forward to hearing what Dr. Maycock has to say about that,
Good
about
morning.
how their outreach
Hey,
is
Dr.
working.
Maycock.
Hey,
Hey, this is Todd. How you doing?
I'm well. How are you?
Doing real well. And we have Cindy on the line with us, Cindy Fisher from the Selma Sun. And boy, we just really appreciate you joining us this morning. It's great to talk to you again. How are you doing this morning?
I'm well.
And tell us, now, at UAB, I know we spoke, I believe, last week about how things are going at UAB. Could you give us an update on the testing and the patients? I know we had one of the doctors last week talk about a number of patients had gotten well and were being discharged, so that was on the positive side. But there were still some that were very, very sick. How are those doing, and what is the latest?
Well, our here at the Vaughn Regional Medical Center, we have about a couple of patients that are in the ICU with the virus, and then one that's on the floor. But they're getting better. The patients, we have had a lot of patients that have come in that are COVID positive that we treat on the floor and send home and have them complete their recuperation at home. So.
Oh wow, that's a good sign. That's a good thing.
Yeah. And then totally in Alabama so far, we've had about 5,327 cases in this state of Alabama. Only 696 of those had to be hospitalized. And in Dallas County, we've had about 29 confirmed cases. And so that's where we are right now. It seems like the number of new cases in Alabama has kind of plateaued, and so that's a good thing, too.
Yeah, we were talking earlier that it's plateaued, and then you'll see a few jump. Would you say that the new cases are more due to the testing being more or more available, and the turnaround becoming a little faster with the testing?
Well, that definitely helps. I think it's a balance between that and then us, continuing to quarantine and reduce the risk of exposure.
Right, and with that, they're talking about reopening some businesses in a phase system. But are we jumping too soon, or is it time to start thinking about reopening businesses and maybe easing some of the quarantine rules?
In my humble opinion, I think we're jumping a little bit too soon. I would prefer, I'm a bit conservative, and so I would want to hold off a little bit longer, because even though it's plateauing, it hasn't started necessarily going down yet. So I would wait until we're out of the woods, because the thing is, when you look back at other things, like back with the Spanish flu 100 years ago, when people came out of quarantine too early, then they had a second spike. And so I would want to make sure that we're on the good downward slope before I started, releasing some of those restrictions.
Understand and agree. Cindy, didn't you have some questions about their procedures that you wanted?
I'm just looking at whether are people not coming in because they're afraid that they're going to get it when they need to be coming in for diabetes or other just regular checkup issues?
Correct. I think some people are definitely not coming into the clinic or to the hospital for those reasons. I think when people are bad enough that they feel like they need to come to the hospital, I still think that they feel comfortable coming to the hospital, and we do take the necessary precautions when they come in to the hospital setting. But there are some alternatives that patients can use for to get their chronic problems met, during this crisis time. Most clinics are doing televisits or doing electronic visits during the crisis, and so Medicare and other insurance companies are allowing for annual wellness visits as well as other visits to be done via telehealth, and so. So things like getting their medications refilled, if they have cold or flu symptoms, if they want to discuss their chronic problems like their hypertension or their diabetes, if they want to discuss lab results, all those things can be done over the phone and they can be over the phone, which would be audio only, or they could do some clinics have the capability of doing video visits as well, and so. With those visits, the patients will need to call and make those appointments, and they need to also be mindful that the patient will be responsible to make sure that they're in a private area and that, so that their privacy is maintained. And then also, if there's any charges that their phone company is going to give them, they'll need to be responsible for those things. And since this is a legitimate, medical visit, then there's a required consent that would be obtained at the beginning of the visit, and then just letting them know that their insurance company will be charged, and there might be a copay because this is a real visit, and they were going to get the service that they need. And so there's also other ways that they can communicate with their physicians. A lot of physicians have patient portals that are online that they can go and they can look at their labs, and they can request refills and request an electronic visit appointment. So those are some other options that patients can have during this crisis time. Okay. And then there's a lot of offices that are still having patients physically come into the office for things that can't be done, on the phone or via video.
I guess the first thing you need to do to find out what's the best path is to call your physician and ask them
Correct.
what's the best way to go. And if somebody needed to call UAB Family Medicine to set up an appointment, what would they call? Who would they call?
They would just call our office, which is 874. I'm sorry, I don't know my phone number.
That's okay.
It's 875-4184. That's 875-4184.
Right. 875-4184. And have y'all seen an uptick in testing at all?
Yes, we have. We are currently in our office and at Vaughn Regional Medical Center, we are using the Alabama Department of Public Health to do the majority of our testing.
I got you.
And actually, if a person wanted to get testing themselves, what they would need to do is they could call their doctor's office and request an order, because they would need to get an order, and then the Alabama Department of Public Health is having has a tent out in the health department's parking lot, and they're there on Tuesday and Thursday from 10 to 2, and they're doing testing there. But patients do need to have an order from their doctor, and they do need to call for an appointment, and they can call 874-2550 for an appointment, and that's 874-2550, and then they usually get the results back in about 3 days or so.
That's fantastic. Now, one of the questions we spoke with Cachet Smith over at Rural Health, and she brought up the point that some folks like Rural Health are lacking in PPE supplies. Do you have that problem, or have you seen that being a major problem in our area?
We don't. We currently don't have that problem. It is definitely a problem nationwide. right now, the masks and things are generally available, but we are watching our supply very carefully because they are. It's not an overabundance, but we do right now. We have sufficient, but we have to be very, very careful.
Understand that. Cindy, have you got anything else for Dr. Maycock?
No, but thank you so much for what you do in the community.
Well, you are welcome. It is definitely our pleasure. We are glad that we are here at UAB Selma Family Medicine to be able to take care of the patients in the hospital and in the clinic for their needs, especially during this trying time.
And thank you so much, Dr. Maycock. It's so great to talk to you again, and be looking forward to talking to you again soon.
All right. Thank you.
Dr. Tiffany Maycock, UAB Family Medicine. Boy, I tell you, it seems like all of our medical facilities in Dallas County kind of jumped on it pretty soon and came up with ways to be sure that all of the patients are cared for in the best, safest manner. And that's a good, positive thing. And I think being in a rural area where it didn't hit as quickly as it did in some of the big areas,
that helps.
That helps a lot.
It does. Yeah. I think it gives them a chance to see what's working in other areas that might be harder hit. But I will tell you, I like to watch the national news each night, and it's hard to look at New York especially, and bodies that
right.
have to be in a cooled, refrigerated whatever outside. I just can't imagine that here.
Well,
it makes it hard. It makes it hard for us down here to see this as a real thing because that looks like something from a movie. We don't have that many people in mass that can catch it and are at risk of dying from it. So it's very sobering.
Yeah, it can be. And I tell you what really struck me, and first of all, don't get me started on what I think about the national media and how they present certain things. I'm not going to go there, but I did see this. The streets of New York City, which is a city that I have been to multiple times, and although I love country and rural, that's where I want to live, it is exciting and fun to visit a big city like that.
It is.
My actually first favorite city in the world that's not my hometown is New Orleans. And to see pictures of New York and New Orleans, bare. There's not a person in the streets. There's New Orleans, Bourbon Street, which is usually packed like a bar, and there is absolutely no one. But some cool things have happened. I know down in New Orleans, for instance, there was a lot of people who are getting on a lot of the musicians are sitting out on their front porch and still playing their music.
I think that's
on
awesome.
Isn't that awesome? And a lot of the buildings, they live upstairs, so you could walk down the streets of the French Quarter and still hear some music because they're going out on their balconies and porches upstairs from all the businesses and playing. So there's ways around some of it, but it's still, like you say, like a movie. It's just spooky to see a big city with nobody walking on the streets. Another problem they're having? Speeders. Cars. People driving too fast in the streets because there's no traffic.
Oh.
Yeah. I mean, they're looking at it like an opportunity to see how fast they can go, but the police are looking at it as, we're not going to have this. And it's been a problem. New York, I know in London it was a couple of stories about that. I hadn't seen anything from New Orleans yet, but some of the bigger cities, that has been a problem. I'm going to call and get Miss Cheryl on the phone, and let's talk about the businesses and some of the availability of small business loans and grants. I know one of them, they opened it up Monday, and it closed up Tuesday morning. That was a nationwide.
Really?
Yeah, it was that quick, and we'll get her to talk about that one.
And I totally understand that folks need to be, especially retailers. This is how we make our money, bringing in people, and online sales is a challenge.
Good morning, Miss Cheryl. Hey, how you doing this morning?
I'm doing fantastic.
All right. We have got Cindy on the line and myself, and we just wanted to see what you had to say about the the business atmosphere right now. We had spoken about some loans and grants and whatnot that are available for small businesses, and I was telling them about the one that opened up Monday and closed Tuesday because so many people called in and got it already.
That's right. That was the StateSmallBusinesses.com. That was being funded by the U.S. Chamber of Commerce Foundation, and applications closed the next day, Todd. So that wasn't surprising, but it's saddening. So today we're waiting to hear what I believe Congress they passed the first part of the bill for $260 billion yesterday afternoon, and we're waiting for the next leg of it to pass, and then the PPP program will open back up, and caution everyone that it's going to go just as fast as the first round did. So if you're wanting to make your application, you need to be ready because it's going to go fast too, unfortunately.
I guess that's one of the things we had talked about is that any of these grant loan programs that are easy to get for small businesses right now to help them stay afloat, they are easy enough to get that they're going quite quickly. So when you hear about it, you need to jump on it immediately.
That's right. You can't put it off for a rainy day. You've got to stop what you're doing. If you got a business, you got to find somebody that can take over so you can go down, either go online and apply or go down to your bank and get the paperwork. There's a lot of these PPPs that are in a queue, so as soon as that opens up, they're going to take care of those folks first, and then, like I said, the second round will open up. It looks like if all goes as planned, it should open up Thursday, tomorrow.
Well, what are some of the other available programs that you had spoken about earlier?
Well, some of these are looking at the second round, and one of them is a company called Bank. And they already had the grant is for women entrepreneur business owners. So if you're a woman and you have a business, you need to mark your calendar for May the 4th because they're going to open up their second round of grant funding on May the 4th, and it's called redbackpack.org.
Redbackpack.org.
Right. And that's going to open up May the 4th.
And there was a couple others that you had spoken about when we talked yesterday.
Yeah, I come across one for volunteer fire department, folks that are volunteer firemen and personnel. Don't have that link in front of me, but if you send us an email at info@selmaalabama.com, we can certainly send you some information or give us a call. We are there working, even though we're closed. We are coming in each day to the office and working. A lot of these grants that I've researched out are regional grants, so they apply to certain states and communities. And so even though the list looks long, you have to go through it. And I'm finding that some of them are already closed as well. So it's an ongoing process. That's what I spend most of my time doing is researching and trying to find tools and resources for our businesses and companies around our community.
So I guess they just need to call you or email you, and then you can put them in the right direction.
Right.
Fantastic.
And that's you don't have to be a member. We're helping anybody in our community. So, the Chamber's a membership organization, but we're not turning anybody away. We're here to help and be a resource.
So members and non-members. Well, have you had any feedback from our local business owners? What are they saying? Anything yet?
Well, they're getting concerned. Like I said, our lodging was doing very well because of the project out at International Paper. And, it's like a process. So you've got one that's kind of flowed out. Those workers are kind of flowed out. So our hoteliers are getting a little concerned now. When are we going to open back up? And, we want businesses to open up, but we want them to be precautionary and take best safe practice measures as well.
Amen. That's what we were talking about earlier about the Georgia's trying to open up Monday. Other states are trying to open up soon, and we're just kind of holding back and looking and putting it off a little bit at this point. So I guess we'll just have to see how that plays out, and then we'll have to adjust accordingly.
That's right. But I just want to say enough to thank everybody that's out there supporting our community. You know, Selma's a great place. Selma's a nice place to live. And in these kind of times, that's when our community always comes together, and can't say enough about supporting small business, local business owners, especially during this time.
Well, exactly. Support our local businesses. Well, thank you so much again, Miss Cheryl. I really appreciate you and what you do. I know you work hard and probably don't get enough appreciation, but thank you so much for all you do.
And I appreciate y'all, too. Thank y'all, and y'all have a great day.
Thank you, ma'am.
Thank you.
Ms. Cheryl Smelly from the Selma, Dallas County Area Chamber of Commerce.
You know, she makes a really good point about grants. We, the Selma Sun, have applied for a grant through Facebook, actually.
Oh, wow.
And found that one that helps with staffing costs or technology, especially for things that you may not ever be able to afford, and especially that will help you with alternative ways of making revenue.
Oh, yeah.
So that's kind of like what we were talking about before she called. I know the e-commerce is actually really hard to set up. I'm curious to hear from, I know Harper's Chapel, Henley Barnes over there, she set up where you can buy online now. And I know that WordPress has the ability to set up an e-commerce line, but it's hard. You've got to know how to build a website to do it. So I think that that it's some of these grants that I'm seeing out there that are through other foundations are actually targeting how to grow your business in a time when and branch out into other and be more creative with how you're bringing in revenue. That's what we're looking to do with video and podcasts. It's kind of interesting because you don't have as much going on as we do because we're news.
Right, exactly.
But
yeah,
there's some that don't have as much going on. This is a great time for a lot of businesses to start really thinking about what the future looks like for their business. What kind of extra line can we start offering? Services like Kingfisher Media, that my company that owns the Selma Sun, we also offer PR services. And so we actually have clients that we do press releases for and reach out to other media throughout the state or even the country in order to get their business noticed. So that's an extra arm for us for revenue that's not just a newspaper, using expertise that we have. So I think that this is a great time for businesses to be thinking outside the box, that their normal box, and see what other kind of, and it may be something that could work after the pandemic, where it could be something that can help your business grow.
I agree 100%. I think that's some good points too. Let's shift gears a little bit and go on, and let's we won't start having Bullet Hand on a regular basis to give us updates on sports and stuff like that.
Let's hear about our new coach at Morgan.
Here we go. This is Bullet Hand.
Went there and he was 1-9 his first year, but then turned them around, went 10-2 and deep into the state playoffs his second year, and we're hoping he can turn around the Senators, who were 4-7 last year. Coach Raines, basically, what's your philosophy as far as offense goes for the Senators? Will you try to install some kind of spread, or will you just run I formation, or what's your offense philosophy?
We'll try to be multiple. And Mr. Bullitt, the main thing, I think you're a lot better football team if you can run it and throw it. So I think that's critical to be able to do both, run it and throw it. So we'll get working on that. And a lot of I know I referred to my dad earlier, Coach Jim Raines. A lot of what we do came from my dad. A lot of what we do on Friday nights will be, my dad gave it to me years ago, and bless his heart, he been very successful with it. But we'll do a lot of formations. We'll get under center some. You mentioned the spread. We'll do the center. We'll get under center. We'll be in the spread. We'll get some unbalance and some motion. But have fun with it as well. But also, main thing goes back to being able to run it and throw it, and we're going to be aggressive. we're going to be aggressive on both sides of the ball.
Okay. Our listeners know about what Morgan Academy has coming back. The Senators did go 4-7 last year after making the state playoffs the previous 2 years, did not make it last year. But Morgan Academy only had 5 seniors, and everybody, I think, knew it was a rebuilding season. I don't think anybody thought it would be as bad as 4-7. So you do come with some weapons. In case you don't know, Coach, I don't know if you've had a chance to watch any huddle of them. You know, we've got one of the best running backs in the AISA coming back, and Holt Utsi. He'll be a senior. We'll have an experienced quarterback coming back for the first time in like 5 years because only a senior is quarterbacked since Gunnar Henderson was a sophomore and decided not to play his junior year. But Andrew Thomas will be back. He's got some weapons on the outside, and Josh Brown. Have you looked at any Morgan film from last year or anything like that yet?
Very little. Actually, my wife pulled up Huddle one time on her phone one night, so I watched a little bit. Haven't seen much, but everything you said sounds very exciting, and just look forward to meeting these kids and start putting our stuff in and getting ready for Friday nights. Nothing like those Friday nights, but I just, you told me a lot more than I did know already. I know I talked with Coach Thacker. Coach Thacker told me a little bit, but you just helped me a lot. So I'm just looking forward to meeting these kids and getting to know them.
Well, you know, it's not rocket science. A lot of it goes back, and I'm sure you're one of these guys, it goes back to blocking and tackling and not making mistakes. And so hopefully, you know, the Senators will improve in that area. They were penalized a lot last year. What about defense? What kind of defensive stuff can we look forward to seeing in the fall?
We'll be multiple on defense as well. We'll just do some 4-man fronts, some 5-man front, get some goal lines, you know, obviously 6-man front for that. We'll blitz from different places. We'll play some man. We'll play some zone coverage. Just really want to be multiple on that as well, and try not to let people get a beat on what we're doing. We'll be multiple, mixed up. Really that same philosophy as offense. Want to be able to do both things, run and throw it. Defensively, we want to be able to do different things as well. So, and we're going to be aggressive, and we're going to have fun. We're going to get after it.
Yeah, I know you said have fun lots, and I know we have a lot of fun in the broadcast booth. Folks, in case you just joined us, we are talking with the new Morgan Academy head football coach and athletic director. His name is Danny Raines. He has 17 years head coaching experience in the state of Alabama at Fayette High School Berry High School up in Fayette, and at Headland High School down around the Dothan area. It's actually in Henry County. So we're glad to have Coach Raines as the new coach. He's only had 3 losing seasons in his 17 years of head coaching, and 2 of those 3 were his first year at Headland and his first year at Berry. So he turned those programs around. And I think he won't brag on himself, Coach, but I'll go and brag for you. I think you're the winningest coach ever at Berry High School, and you got Headland to the playoffs for the first time in 20 years. Are those correct? I mean,
thank you. Yes, sir. You're very kind. I appreciate your kind words. Yes, sir. I've been blessed, and I'm thankful it's going well, and really just looking forward to getting started at Morgan Academy. But I really enjoy my time at both Berry and Headland. Nothing like those times with those players and coaches, and just looking forward to trying to have a successful program and at Morgan Academy. And like I said, looking forward to meeting everybody. And I appreciate your kind words so much.
Oh, you're more than welcome. Was it tough to say goodbye to the kids at Headland when you made this decision?
Oh, I love those kids so much. And here's what's bad. Our situation happened when when we were out of school. So as a matter of fact, I sent them all a text and said, I'd love to hug every one of you. I mean, because they really are family to me. They really are just great kids, lay it on the line for you every night. And so it definitely wasn't ideal with all this virus going around, but I love them, and they know I love them, and just I know they'll do well. I wish them the very best going forward. Yes, sir.
Yeah, it's been a difficult and quite frankly just a weird situation. One of my sons asked me the other day, "Dad, you miss sports on TV?" And I'm like, "Oh yeah." I mean, the start of baseball season, the Morgan Academy baseball season got halted, and tennis and golf, and Morgan Academy's won multiple state championships in tennis and golf over the last few years, and so it was very difficult to see that. But we just got to do our best to not spread the virus and hope we can return to normalcy. And I kind of think that maybe the first thing we'll see for normalcy will be, if we don't get to play a little bit of summer baseball, will be some kind of maybe football starting up with practice. They normally start around the 1st of August, and the first game's against Wilcox on the 28th, so I think they would at least start 3 or 4 weeks before then. And you may not get any 7-on-7 time, Coach. You won't get any spring times in, but I guess it's kind of even for everybody. It's really not, because everybody else has their coach they had last year, whereas Morgan Academy will not. But I guess you have to plan to install stuff quickly.
Yes, sir. We'll just do the best we can. Obviously, the earlier, like you said, the earlier we can get started, the better. But we'll just do the best we can when we can get started, and hopefully we can get started sooner than August 1. I hope we can. I hope we can start do some things, even if we can't do 7-on-7. Hope we can do some things during the summer.
Well, I know the strength coach, Tommy Weber's been working with the players, for about a year now. And I know a lot of them have been doing their workouts at home, practically all of them that I've gotten reports on. So I think you're going to have a dedicated bunch. We talked about Holt Utsey and Andrew Thomas and Josh Brown coming back, but you also have a very good place kicker in Wade Mason. He was fantastic last year. He'll be a junior. Some big seniors on the defensive front. Kenneth Nichols has basically played since he was an 8th grader, and big Clayton O'Shields. So I would think, as far as personnel goes, you should have a better line. Like I said, only lost 5 guys. Now, they were good seniors, but there was only 5 of them. So you do have a lot of guys coming back that have playing time. Great.
That sounds wonderful. That's nothing like that experience either. It really makes a world of difference when you have that game time and experience. Nothing like those Friday nights. So sometimes you think a kid's ready to go, but until those lights come on Friday night, you don't ever know for sure. So that's exciting that many kids have experience that aren't going to be back.
And a lot of good 9th graders. Junior high went undefeated this past year, and a lot of 9th graders, as many as maybe 10 or 11 9th graders will be sophomores and coming up too. So that should also help the program. Well, Coach, we really appreciate you being with us. Before we say goodbye, I would just like to just ask you, what's your philosophy like dealing with the players as far as do you have a lot of meetings? Are you big on discipline? And just how do you mentioned having fun, which I think is the way high school footballs are designed to be, but there does have to be some discipline. And what's your thoughts and your philosophy on that?
Oh, yes. I'm a firm believer in discipline because everybody just needs to – we're not going to have any bad attitudes. We're not going to – everybody be a good kid first, which I don't anticipate that being a problem. Everybody be a good kid first. Do the best you can. We're all going to make mistakes. I'm going to make mistakes. Kids are going to make mistakes. Nobody – Jesus Christ is the only perfect person here, so we're going to make mistakes. So just go full speed, have a good attitude, do the best you can. I expect them to be there. You can't just come to practice when you want. And everybody just do the best you can, and then we're going to prepare. We're going to prepare. We'll be prepared. We'll have some scout reports. The players will need to learn. They'll have to take it seriously, and that's going to get them that's going to help us on Friday night. That'll get them on the field as well. But if you don't have everybody going in the same direction, really, it's got to be important to everyone involved. If it's not important to everybody, then you can't be as good as you possibly can be. So really I know I've mentioned having fun, but we're going to be good kids, do things the right way, be good students in the classroom, do everything the best you can, and on the field, go full speed, try to do what your coaches ask you to do, and then we'll go at it on Friday nights.
Well, thank you so much, Coach, for being with us. We really appreciate it. We look forward to seeing your football team right out there on the field on Friday nights this fall.
Yes, sir. Thank you so much. I appreciate you, Mr. Bullitt. Really appreciate you having me.
Well, thank you. Thank you, all you folks for listening in. We appreciate you joining us on this first ever type of situation, and we hope to do more of this in the future. For all the folks at Scott Communications, this is Bullet Hand saying so long.
Great interview. Boy, that sounds like some excitement coming up for Morgan Academy, Cindy.
Absolutely. I'm looking forward to hearing more, seeing how he interacts with the students and with the athletes.
Yeah, that's going to be interesting. Well, why don't you give us a quick rundown of what to expect in tomorrow's Selma Sun, and as we wrap up the show.
Yeah, one thing we didn't talk about today is a new cancer care center is opening, and it's going to be at Vaughn in some extra space at the Vaughn, and this will help for residents with cancer to not have to go to Montgomery or Prattville or Birmingham for treatment. So that's really exciting. We talked to some Morgan Academy seniors to talk about that shortened sports season, talking about, there's several, baseball, softball, tennis, they didn't get to finish their careers. So we talked to a few of those. We've got a rundown of the SRA, so that's the Selma Redevelopment Authority, and they are still meeting via teleconference, so there's some interesting stuff going on there. So we have quite a few really interesting and informative stuff about the unemployment rate so far, at least. So yeah, grab a copy. We have some, and we have 7 news racks around town, and also doing the e-edition for free online right now at selmasun.com.
Well, fantastic, Miss Cindy. Thank you again so much. And I reckon we will be looking forward to the paper tomorrow.
Absolutely. Check it out online at selmasun.com.
And thanks, everybody, for listening today. We'll have more next week on the Sunspot. Just have a great week and stay safe and stay healthy.
Yes.